Intravenous nutrition therapy delivers vitamins, minerals, and other nutrients directly into the bloodstream. It offers a powerful tool for healthcare practitioners to optimize patient health within a functional medicine framework. And by addressing root causes of disease, IV therapy restores nutrient balance and supports cellular function, enhancing physiological processes, aiding detoxification, and promoting healing. Now, unlike oral supplements, which are limited by digestion, gut absorption, and first pass liver metabolism, often reducing, by the way, bioavailability significantly, IV therapy achieves 100% bioavailability. Now, this ensures that nutrients like vitamin B6, B1, B complex, other vitamins like B12, vitamin C, calcium, zinc, and glutathione reach systemic circulation fully for the body's use. For the patients with impaired gut function, such as those with Crohn's disease or celiac disease, this bypasses absorption barriers entirely. Now, the benefits are clear: rapid correction of nutrient deficiencies, higher tissue saturation for therapeutic effects, and personalized formulations that can be tailored to individual patient needs. For example, intravenous vitamin C can achieve plasma levels 10 to 20 times higher than oral doses, which supports antioxidant activity and immune function in patients with oxidative stress. Similarly, magnesium-rich infusions may help alleviate symptoms like muscle tension or fatigue, while glutathione supports detoxification pathways. This isn't about diagnosing, treating, curing, or preventing disease. It's about supporting nutrient repletion as part of a comprehensive plan. IV therapy can seamlessly integrate into your practice, requiring only a sterile setup and a proper compounding protocols. It's particularly valuable for patients with chronic fatigue, fibromyalgia, migraines, or those recovering from acute illnesses or surgery, where nutrient shortfalls may be typically higher and need more than normal. Always assess patient history, lab results, and contraindications to ensure safety. Administer under supervision. Take a course, learn how to do it properly and safely. IV therapy offers a proactive way to enhance patient outcomes, complementing diet, lifestyle, and conventional therapies as well. And by addressing nutrient gaps efficiently and effectively, you empower your patients to feel more resilient and energized, potentially boosting satisfaction and compliance in your practice.